Ulcerative colitis. So basically, ulcerative colitis is one of the two types of irritable bowel disease, which is Crohn's disease and ulcerative colitis. Both are autoimmune diseases, which the immune system attacks the specific body parts. In which case, ulcerative colitis is mainly colon. What will be discussed in this presentation? What is ulcerative colitis? What are the symptoms and the diagnosis? And what is the ideal approach? What is the most common complications? And one case about ulcerative colitis. Ulcerative colitis is a long-term condition which the colon and rectum get inflamed. So it's a chronic disease. The colon is the large intestine, and the rectum is the end of the bowel, where poo is stored. Rectum is the place where the stool is stored. Small ulcers can develop on the colon's lining and can bleed and produce pus. In this disease, the ulcers bleed and produce pus. What are the symptoms? The symptoms vary according to the severity of the disease and also the condition of the patient, general condition, and also the duration of the disease that the patient have. It includes abdominal pain, urgency to poop, diarrhea, constipation, bleeding per rectum, toxic signs and symptoms in the flares like high-grade fever, severe abdominal pain, severe bleeding, like fresh bleeding per rectum, and all other symptoms. Here are some more symptoms of the disease. We have the consequences of the disease, like weight loss or chronic fatigue, which contributes to the anemia or nutritional deficiencies because of diarrhea and the bleeding. And we have dehydration, eye pain, joint pain, liver diseases in long term, mucus or pus in the stool. Diagnosis. So the diagnosis, we start by clinical examination of the patient, blood workup like CBC, CRP, ESR. These are the main blood workups for this disease. And we have stool workup, general stool, and fecal calprotectin. So basically, we do general stool for the diarrhea. Maybe we have something else. And fecal calprotectin is it is most specific for inflammatory diseases. And definite diagnosis is by colonoscopy. And we have other non-specific tests. So the ideal approach for this disease, in a patient we start by topical steroids like methylprednisone or antibiotics, aminosalicylates. After that, we have immunomodulators like azathioprine and mercaptopurine methotrexate. Azathioprine, which is known by Imuran, or mercaptopurine by the name of purinethol, and systemic steroids. So we start by topical steroids, and this vary with the disease, with the severity of the disease and the duration of the disease. And after that, the next step is, if not controlled, the next step is biologic drugs like infliximab, rituximab, those kind of drugs. After that, cyclosporins, and the final management, the final therapeutic treatment for this condition is surgery, which is removal of the part that is included in the disease. Because in this disease we have like many types according to the location of the disease or the location of the condition. Some have like all the colon, from the anus, from the rectum until the terminal ileum, which is known as pancolitis. And some include of descending colon, transverse colon, or ascending colon, or just rectum. So it is different. What are some complications of this disease? As intestinal complications. So because if it is like inflammatory, it makes ulcers, so it is more prone to cancer. So one of the complications is colorectal cancer, bowel perforation, and bowel obstruction, fistulas, strictures, and megacolon. Megacolon is a severe complication in the flares. Maybe the flare is not controlled and so it goes to megacolon. And neuropsychiatric, we have depression and anxiety because of this disease, and nutritional deficiency, anemia, and the psychological feelings, psychological condition of the patient change with this disease, because you can't do anything, because it is aggravated by the flares are aggravated by heavy exercise, so they can't do any exercise. Stress, so life is a major part of life is stress, so basically they get aggravated by that. Cardiovascular, heart failure, atrial fibrillation, venous thromboembolisms, coronary artery disease, myocardial infarction. Other complications: non-specific musculoskeletal, cutaneous, ocular, hepatobiliary, visceral pain. Now we have a case to discuss how it got managed, how it got discovered, and the diagnosis and all things. So we have 12 years old male presented with abdominal pain and diarrhea for 1 week duration. After lab workup, it is defined as amoebiasis. After clinical examination and lab workup, it is defined as amoebiasis of Entamoeba histolytica. After nearly 14 days of antibiotics and supportive therapy, the patient's situation didn't get better. The diarrhea became bloody, and general stool exam reveals no Entamoeba histolytica. So after taking treatment for amoebiasis, Entamoeba is gone, but the diarrhea became bloody. It's really strange. So after further workup and detailed examination, he diagnosed as ulcerative colitis, and colonoscopy confirmed it. After much detailed examination and workup, he finally diagnosed as ulcerative colitis, and colonoscopy confirmed it. But the time between the colonoscopy and the diagnosis I think it was like 1 week or so. So before the colonoscopy, the condition controlled by methylprednisolone IV. And the second colonoscopy revealed that it is pancolitis, the whole colon until the anus. And the current drugs that he's on, it is mesalazine tab, 1 gram. It is 5 acid drugs, 1 gram, 1/2. He takes this tab 2 times a day, and mesalazine suppository also, which is also I think 1 gram. Mercaptopurine, because it's pediatric age, azathioprine has many side effects for infertility and those stuff. So he takes mercaptopurine, 50 milligram 1/1. Steroid prednisone, 20 milligram 1/2 in the flares. And that was it. That was some notes about ulcerative colitis. I hope you got informed about this disease, and thank you for listening.